this, and it will be posted later to our channel. So this is the Community Behavioral Health Information Technology Coalition, and my name is John Glover, and I'll be your facilitator today. I'm a licensed clinical social worker and behavioral health project specialist with Metastar. What we're going to do today is we're going to have a few announcements, just a couple announcements. We'll do some introductions. I see we have a couple of new people have joined today. And then we'll have the presentation by Jeanette Solar from Oakwood Clinical Associates. And after that, we'll have our discussion where, hopefully we can all join in and talk with Jeanette some about experiences and help answer some of her questions. And then at the end, of course, we'll share a few resources that we came up with you. So by way of announcements, for those practices participating in our behavioral health initiative, please be on the lookout for our invitations to complete the final health IT maturity assessment that is required by our funding with Wisconsin DHS. We need to complete these assessments by April the 30th. So that we can get that information to them. And then the next thing we want to do, just getting going today, is we want to start off with our first poll, is a poll about EHR use. Laura, you want to introduce that and
Sure. I'm going to I'll launch that poll right now. John, and this is just a very general question about how long your organization has been using its current EHR, if indeed they have. And then if everyone wouldn't mind, if you are using an EHR, just sharing in the chat which EHR you're using, just so that we can get an idea of who all is using and what they're using.
And I'll just mention that, Metastar is vendor neutral. And so this is not about trying to see, the most or the best or anything. We're just trying to get a sense of, what kind of EHR products people are using.
And we did just have a couple of people, John, enter in. And so I'll leave this poll up just a moment longer for those of you who just entered. If you wouldn't mind putting in the chat which EHR you're using, as well as your name and where you're from. And I'll leave this open another few moments.
Great.
Okay. Go ahead.
Laura, you just let me know when you feel like you've got the responses.
Okay, I will go ahead, and I just ended it, and I'll go ahead and share the results. There we go with everyone. It looks like we have a good mix of people. Are you able to see those results, John?
Yes. So, boy, this is great because it looks like we've got some people that are pretty experienced with over 5 years of use, but we've got a lot of people either not using one yet or in the early stages. So fantastic. I like that split. It's great. Okay.
Here we go.
So by way of introduction to this process, we want to remind you this is not a webinar. It's a topic-focused learning group. So we encourage you to join the conversation and remember that we're all here to learn from each other. So please chime in and help out as Jeanette goes through, her presentation later today. So let's take a moment to do some introductions. See if I can go through this. Sometimes it's a little tricky because people coming in and out, but let me see. Can we start, Matt? Can we start with you? I see it, in my screen, I got you up in my top left corner. So,
sure. I'm Matt Ives. I work for Wood County. I'm a programmer analyst there. I primarily handle the health and human services softwares, including the EHR.
Great. All right. Great. Thanks, Matt. Fern, I got you up next.
Hi, I'm Fern. I'm a psychotherapist and continuous quality improvement manager at a very small nonprofit in Madison, Wisconsin. I do kind of basic database management, and I'm helping to explore moving towards the EHR in the next couple of years. So minimal knowledge about EHRs, and want to hear what it's like for those who are using them.
Great. Thanks, Fern. Next, I have Shannon. You just tell us about your role in clinic.
Yep. I am Shannon Solar. I work for Behavioral Health Services for Memorial Medical Center in Ashland, Wisconsin. I work with our outpatient recovery service providers, and they also work over on our behavioral health unit as well. So I'm here to support them.
Yeah, great. Thanks, Shannon. All right, let's see. Then I have Cheryl. You able to unmute, Cheryl? Maybe not. So let me go on to Tom. You want to just introduce yourself, to say who you are and your role in the clinic? There you go.
Hi, Tom Trin with Ozaki County Human Services. I'm the Assistant Administrator and Database Administrator for all their electronic case management systems and EHR.
Great. Thanks, Tom. Cheryl, it looks like you got yourself unmuted. Do you want to introduce yourself quickly?
Hi, everyone. I'm Cheryl Kettlehut. I'm the CLTS, CCS, Birth to 3, and other C programs administrator in Taylor County.
Great. Thanks, Cheryl. And then I have Samela Jolly. Samela?
Hi, everyone. I'm eating lunch, so I have my camera off. So my name is Samela Jolly. I'm the Director of Clinical Services at Guest House of Milwaukee, which is a nonprofit here in Milwaukee that serves homeless individuals. My role is oversight of our outpatient counseling clinic, as well as our CCS program. So I'm here to hopefully get us a EHR system. So I'm happy to hear about what everybody else has been using too.
Thanks, Samela. All right. Let's see. So I think, oh boy, my screen's jumping around. So let's see. Ashley, could we hear from you?
Yeah, my name is Ashley Downing. I live over in Wausau, Wisconsin, working for North Central Healthcare, and we use a few different EHRs because we have both behavioral health and nursing home. So excited to talk about that.
Great, thanks. And Taryn?
I'm the health IT tech for Unified Community Services in Granton, Iowa County. We're currently looking at EHRs for possible switches.
Great. So this ought to be a good conversation today. And then Connie?
Hi, this is Connie Gadarian. I work for Behavioral Services of Memorial Medical Center as well. I'm the administrative manager for the Behavioral Health Services Department, and I oversee or directly supervise our medical records and support staff, as well as help our IS department in the hospital as an Epic super user.
Great. Thanks, Connie. Kimberly, are you able to hear us and respond? It looks like maybe you're connecting.
Yes, I'm coming in over the phone. Can you hear me?
Yes, we can. Thanks, Kim.
All righty. I'm from Fond du Lac County, the Department of Community Programs. I'm the Medical Records Director and HIPAA Privacy Officer. And I am also a super user and trainer of our Avatar electronic health record. So we have outpatient behavioral health, substance use services, and our acute psychiatric inpatient unit.
Great. So glad you could join us today. Thanks.
Thank you.
And then I think the last person I have, Jennifer.
Hi, I'm Jennifer Moore. I am also from Wausau, Wisconsin. I work for Ashley Downing at North Central Healthcare, and I'm a informatics analyst.
Excellent. Thanks, Jennifer.
Thank you.
All right. Have I forgotten anyone? Is Dan? I didn't get Dan. You jumped up on the top there, Dan.
Dan Williams, I'm the Director of Greene County Human Services. We're currently looking at bringing on board an EHR specialist and potentially transitioning our EHR.
Great. Thanks, Dan. And I see Pamela's joined us as well. Pam, you want to introduce yourself quickly? Oh, you're on mute, Pam.
Sorry about that. That happens to me all the time. I think I'm clicking it off and it's not. Sorry about that. My name is Pam Hansen. I am the Director of Positive Outlook Clinical Services, and I'm just here to learn a little bit more information about EHRs. We don't currently have one at this point, so just kind of interested in what others kind of have to say about it. So thank you.
You bet. All right. Anyone that I didn't catch before we move on? Doesn't look like it. Okay. So thank you, everybody. It's important that we kind of get to know each other. So I appreciate you taking a few minutes to do that with us. So our Metastar team, we have Lynette Hesse is with us, and she's going to be kind of joining in with the discussion wherever, it sort of seems like she might be helpful. Chris Becker is also going to be helping out, and he'll be monitoring the chat. And so if you have questions or put things in the chat, he'll try to, notice that and bring you into the discussion. Lori's always running things for us, handling the polls and the slides and the presentations and everything. And then Julie's going to keep notes and make sure everybody gets the follow-up notes for the session today. So just want to thank the rest of the team for all pitching in. All right, so today the topic presentation is going to be on EHR optimization, and Jeanette Solar of Oakwood Clinical Associates in Kenosha, Wisconsin has offered to present today. So I'm going to ask Jeanette to just tell you a little bit about her role there and Oakwood Clinical, and then we'll let her walk through the presentation, and then we'll just kind of have a discussion with her about some of the questions she brings up. Go ahead, Jeanette.
Hi, everyone. I'm Jeanette Solar. I work as the assistant to the director at Oakwood Clinical Associates in Kenosha, Wisconsin. And I've been here for about 4.5 years now. So we have had an EHR the whole time that I've worked here. This clinic has actually been on an electronic health record for over 10 years. So they were actually one of the first clinics in Kenosha to have an EHR. So we have an EHR, we're using Valent. We have kind of taken Valent and customized it to meet our needs. We have created our own templates for assessments, for progress notes, for things like that. So we've modified the system to make it work for us. And Valent was promising, big changes for a lot of years, and they have switched over to a cloud-based system now, which is a little better. But there's still certain things that we would like to see out of a system that we just don't get with Valent. A big thing right now, and since the pandemic began, being able to have telehealth integrated into the EHR would be huge for us. So right now we have a separate system for signing documents, e-signing documents. We have a separate system for telehealth. We have our EHR. We have a separate system for text messaging. So we would like to integrate so that it was maybe an EHR that was robust enough to offer all of those things would be ideal. We also, as we start looking at these options that are out there, we have to keep in mind that we have users in the clinic with very staggering degrees of computer literacy. So when we switched from Next Gen to Valent, we literally we did lose one employee. We almost lost two more. So, so we would like to avoid that. So yeah, so keeping in mind the various degrees of computer literacy with the staff that we have is an important piece for us. As I said before, we kind of were waiting for Valent to upgrade their system. Once they finally did roll that out, it was a bit of a disappointment with the final result that they presented. And we're still having to figure out workarounds. In fact, now we have to figure out new workarounds because it's new problems. So it's time consuming again, which causes a frustration level. I did work with Kevin at Metastar. He came up with some great leads for us to work with. Kind of looking to get from this group, see what EHRs are used. This clinic is a very data-driven clinic, and robust data features are extremely important for us. And again, the telehealth texting and e-signing options, having that all in one system would be a huge time saver. The fourth piece that would be important is it would have to have integrated scheduling, billing, and appointment documentation. So.
Great. And then you had a few questions there that you were asking the group.
Yeah, so the questions for the group are first, what EHRs are they using? What features does the EHR provide, whether or not they're being used or not? So we have some features in Valent that we just don't really use them.
Okay.
Any input that anyone can share in regards to EHRs that they've used in the past, whether it's something that they love, something they really didn't like, something that they just kind of blew their mind and they couldn't figure it out. Whatever the input is on any EHRs that have been used in the past. And then the third question would be, what features would the group consider to be a top priority when they're looking for an EHR?
Great. Yeah. Jeanette, that's really great. Thanks for that. So really interesting that you lost staff around a transition, huh? That they
Yes.
just struggled so much with that?
Yes, it was we learned a couple of things. One, don't do it too quick.
Okay.
So we literally went from Next Gen to Valent, and there wasn't a lot of training time. So what not to do, don't do that.
Great advice.
So, we learned a lot. We learned about opening up communication. I wasn't here at the time, so I only know the notes that I review in the file. Opening up communication, making sure that everybody in the clinic is fully aware of what's happening as it's happening. So it's not something that appears to come from left field and they're not entirely prepared for that to be happening. So yeah, this time around, we're absolutely, I sent out a survey.
Great.
We're getting their input, what they feel like is important. Our fear is that, if we're going to miss something that is really important that we're just not going to think of until it's too late. It's that fear that the obvious is the one you're going to miss.
Yeah.
So,
Well, let's throw it to the group and see if people can sort of jump in and offer some answers here to some of what you've asked about it. And I'm thinking, just any experiences is one thing. Jeanette's asking, she's looking right now, wondering about possible options, is interested in data, and interested in EHRs that might integrate several of those services. So who wants to jump in and say a little bit about, what you've learned, where maybe if it sounds like this is more about people who already have that 50% we saw that have been using EHRs for a while?
Hey, Jeanette, this is Chris from Metastar. Maybe you could say a little bit. I know, I'm just getting my toes wet with the work you started with Kevin before he left. I know you really liked a product called InSync. Have you had an opportunity to do any more research on them? Is any information you could provide on them?
Yeah, so I know, John, I don't know if you recall this or not, you were involved in one of the conversations. You and I and Kevin actually had a Zoom meeting at one point, and we had talked about InSync. The challenge with InSync is I love their product. I absolutely love it to the point where I get blinded looking at other things. Which isn't, I guess, a good thing. I have to be able to, I have to present 3. But the InSync product seems very robust. Their data capability seems to be right in line with what we're looking for. When you talk to EHR companies, they tell you everything you want to hear, which is part of the problem. They give you every piece of information that you want to hear, and you have to figure out the reality of that information with your clinic. Because what they're saying is accurate. It's just how does that merge in with the way that your processes are is a challenge sometimes to figure out how that exactly plays out. InSync seems like it would be a very good match for our clinic. I haven't had the opportunity to really speak directly with anyone that has that InSync product in their clinic to get their input. So that's one of my apprehensions, because I would like to actually have a conversation with somebody that's using it, not just the salesperson or a demo.
Jeanette, as someone who's worked for a EHR vendor for 12 years, that would be my recommendation, is to really get some in the field examples. And for anybody going down that EHR path and looking at vendor selection, one of the hopes out of this collaboration, and that's why we asked what people are using for EHRs, is we hope that you're able to establish relationships with people on the line to find out how does this product really work in the field. And as a matter of fact, our January speaker has been using InSync, I think, over 8 years. And their practice site did another one-on-one with the practice site I'm working with that's looking at InSync. So that hopefully this is a great collaboration, because us at Metastar who are not daily using EHRs, it's better to hear it from the field. So maybe that's one of the reasons why we asked to put EHRs in the chat, is maybe we can make some connections, because I know there's a few people on the line in that EHR process. Because you'll notice one of the polling questions said in the last year, well, no one did anything but deal with COVID this last year, and that's why no one implemented an EHR. But I think that's a great opportunity for us to help establish those and nurture those relationships.
Yeah. So that is one of the things that I have to get on my to-do list, is I definitely want to, if they're using InSync, I'd like to reach out and see if I can pick her brain and get more specific on how it's actually working in their clinic. So
hopefully we'll be able to get you set up to talk with some other folks that use that. So other people on the line today who are, able maybe to talk a little bit with Jeanette about, maybe the integrated different platforms? Do you have something that's able to do all those things that she might be interested in?
If it's okay, I'll chime in.
Thanks, Ashley. That'd be great.
Yeah. So, Jeanette, totally hear you on this one because I started with North Central 2 years ago now, and we've been in the process of selecting a new behavioral health EHR. So we went through the whole thing of requests for information, requests for proposal, demos, the contracting, all of it also during 2020 and COVID. And we are going with a Cerner product. So we're going to be moving to Cerner, their behavioral health side of the world. And it's been quite a journey. We've looked at probably over 10 EHRs specifically for that behavioral health piece. We used the healthit.gov to do a lot of our RFP, so your request for proposal. So talking with the different units and programs and departments and saying, what would your question, what are your features you need to see in your EHR? What questions do you want answered? So that when you get those requests for proposals back, you can do a lot of the scoring before you're trying to demo 10 different companies and put big major, leaders in your organization in those types of meetings. We picked a smaller group. Then we had a core team look at that smaller group, and then we picked the top 2 and put that out in front of our teams and had scoring based on that. So I'm more than happy to share anything that you want with that process because it's so new to us. We have not implemented Cerner yet, but that will be happening this year.
What was the IT site that you said that you?
Healthit.gov.
Okay.
It's in one of my favorites. I can send that to you. I'll put it in the
Great.
chat.
Yeah.
Let me just do a little quick Google.
Sure.
And I think that may be part of our resources too. So.
Yeah, I was just going to say that's part of our resources to the healthit.gov. And I also noticed that Pamela had a question in the chat. Pamela, were you referring, what is the cost related to the product, and is this for larger clinics? Was that the Cerner product, Pamela, or the InSync product that Jeanette was talking about?
The InSync, but it would be interesting to know for Cerner too, because I actually come from a small clinic, and so some of the EHRs appear to be more geared toward larger clinics that probably have a larger budget. So I'm more interested in knowing some of the things that are available for smaller clinics that unfortunately don't have very large budgets.
Sure.
Yeah.
And Jeanette, I know you had explored just parallel Pamela's thoughts here too. You'd explored NetSmart, but they outright told you that they didn't want to deal with smaller practices, right, Jeanette?
Yes.
Yeah. So there's some that won't even, they'll tell you that up front too.
Mm-hmm. Yeah, we have 13 providers in our clinic, so we're not a large clinic.
Have you seen any cost estimates for InSync, Jeanette? Are probably not that deep into it yet.
No, I did get a quote from InSync. For 13 providers, 5 office staff, I want to say it was between 45 and 50,000.
So Jeanette, they base it on how many clinicians you have?
Correct.
How many users, et cetera? So that's something to think about, Pam.
Valent does it the same way. It's you purchase what Valent calls seats.
Okay.
Okay. Do you have to? Is there a annual fee or so, or is that the cost?
There are annual fees with both. I know with Valent, it's around, I want to say 500 per user per year. I believe InSync is actually less, and I'm going strictly off of memory here. And memory from probably a year ago. I want to say InSync was between 250 and 300 per user. per year. So it was, InSync was actually less than what Valent's per year charges were.
And Ashley, I assume Cerner's a little bit more expensive product?
Yes, it turned out to not be as expensive as Epic. Epic was very similar. They wouldn't look at us. So they said you could connect with someone who already has Epic and do a one connect. And you can imagine during the pandemic, folks weren't really interested in that. Just being honest.
Sure, sure. Other folks have things that they, might be able to sort of jump in and help Jeanette with? What would you say the top priority? That was one of her questions. What would be a top priority for you in an EHR? If you look at either your EHR or if you're looking to get one, what are your top priorities?
I can respond to that.
Okay, fine.
We would like an EHR that does everything. We want a client portal. We want to have billing and accounting all integrated with activity tracking, and we want to store records electronically. And we'd like one product to do all of that. And that's
at a really
like
good
pie
price,
in the
right?
sky, right? What was that, John?
At a really good price, right?
Yes, at a really good price. Say, I don't know, maybe $30 a year per user. So I guess we're really at the early stages, and at the same time, we're feeling the pressure to move in this direction, because this is, there's increasing accountability for audits and for services, and funding sources increasingly want some kind of electronic health record system involved. So Orion Family Services provides services under a really wide range of funding sources, from county contracts to commercial insurance to grant funds, and managing the activity tracking, let alone scheduling or notes, clinical documents, managing the services with the billing and the accounting, I think, is probably a big piece of it. But we also, the clinical documentation and client access, having clients able to access their records and having some interface for payment and that kind of things.
Right.
Yeah.
For some of you who have EHRs, can you speak to the, sort of this issue of integrated platform that has all these different capabilities? Fern obviously is wanting everything she can get, and Jeanette has asked about that. What about all these other sort of telehealth e-signatures, et cetera? So can anyone else speak to, whether or not you're having to integrate several systems, or if your system has the capability to address those different areas?
This is Shannon, and we have Epic here. We're part of a hospital system, and we're part of a community connect. So anything that we want done needs to be sent into the system that is the head if we want big changes done, and so that can be very, very cumbersome and can take quite a while. It's not necessarily behavioral health friendly. It's because it is a medical, it was set up primarily for medical. Treatment plans have been a problem, but we're trying to get that figured out. So we can't, even though it can do so many things, and there's so many different ways to do the one thing, you can't customize everything. And so even though it can do a lot, there are things that it just can't do. As far as signatures, Connie, you might be able to speak better to that. We are going to be going towards using telehealth through Epic. We had the health Zoom account set up first, and now we're going to be doing the visits through Epic. But I don't recall if we can do signatures or forms on the new way of doing it through Epic.
Yeah, it ties into DocuSign, so it will tie into that. The one thing Epic is not user-friendly about is that we can't do any text messaging like you were hoping. We send everything through a in-basket or like an Epic Outlook kind of mail feature. So it go to them and then they have to sign up with a My Health account or a My Chart account where they can interact with the patients.
So that's really interesting, you know. So Shannon and Connie, is your Epic instance then that one step from someone who's using it, or you said the hospital does have Epic? Is that?
We have Epic, but we are moving to the virtual platform within Epic. Right now, we're just using Zoom or DoxyMe because when COVID hit, we didn't have that access in Epic to do the virtual visits. And now our mothership is going to open that up to the Community Connect clinics to be able to use that virtual through the Epic EHR.
Gotcha. So that's interesting. I mean, even a large EHR like Epic doesn't seem to have everything integrated or is still working on it.
Correct.
Other folks, can you say something about some of the other EHRs that you're using, and, you know, sort of what your pros and cons and top priorities are for them? Tom, you have something?
Sure. Here at Ozaukee County, we've been using a product called Web Harmony. It's been purchased and sold by a bunch of different health IT organizations, which is now owned by WellSky Information Systems. And one of the things that Web Harmony allowed us to do was to integrate with billing. So all the electronic case management was done by the providers through a web portal, and then the activity billing was pulled directly from those databases. And there were a couple of different versions that we could purchase with the county. And one of them was the cloud version, one of them was the in-house database server version, which is what we opted for because it's sometimes better to own your own data, and that way you can create reports as needed instead of having to, you know, contact the software developer to say, hey, we need this report done. We do all of our crystal reports in-house, and we try to get as much data as possible to the managers and directors. One of the things that we have a limitation on is getting client signatures. We can electronically sign documents within our system, but we can't get a client signature electronically. Everything has to be scanned and then attached to the client record as a PDF or whatever. So it's quite it was quite expensive endeavor at the beginning, and the cost is still up there. There's a maintenance cost every year. But the nice thing is that all the billing is electronic, and all of the behavioral health, children and families, treatment plans, assessments, those are all electronic. And they're only printed out if the client needs them or a client signature is required. So I'll field any questions.
Yeah, and so a big decision point for you was whether or not to use the cloud-based system or, you know, something that you could run or make your own reports for without having to go through that process then, right?
Yeah, that was a huge factor. That, and, you know, just being able to access your data when you want to.
So with the cloud-based
So if there was
system,
ever-
you kind of have to put in a request and then wait for them to fill it, that type of thing?
I'm not really sure. You know, this was purchased about 12, 13 years ago.
Okay.
So at the time, cloud-based you know, way back then was in its infancy.
Okay.
Nowadays, I'm sure it's a little more accessible, but it was important that the county own the data server. That way we could more easily maintain it and then integrate it with other systems if we had to. So right now we're integrating it with our electronic prescription. And we also had integrated it with the old AS400 system. So.
Yeah, that's another good point, right? Is the ability to integrate it, which I think, you know, is one of the things, Jeanette, you were asking about, is integrating with other systems. And my understanding, Tom, is that cloud-based systems have come a long way, maybe since 10 years ago. So I think that would be worth checking out for those of you who are looking into those kinds of things, is to ask some of those questions about the cloud-based system in regards to reporting, and how important might it be for you, instead of having cloud-based, just to, you know, have control over your data and the ability to go in and get what you need. So thanks, Tom.
I'll put on my EHR user hat right now, because I also am at a clinic with an EHR and we've been cloud-based for a while and we have access to our data. So I agree with you, Tom, as far as if you put your data in the cloud, you know, there could be some issues about that EHR vendor using de-identified data for certain things, but we are able to access our data at all times from all places.
Great. All right.
We also access our data and we're cloud-based.
Okay.
So.
Great.
One thing COVID's really pointed out is the ability to be nimble and change, right? Weren't we all installing telehealth overnight about a year ago? So I'm curious, for those people on an EHR platform, and I know this is one of Jeanette's concerns, do you feel like you have a lot of flexibility in pulling data from your current system? Is your custom reporting easy for everybody, or is that one of the issues that folks are struggling with?
Anybody speak to that?
Does anybody struggle with reporting?
I think it's a really important question because we work in about 10 different counties, maybe sometimes 12. And there's different, even within just CCS systems, there's different requirements for different counties and different formats for the notes, different ways. Some want things faxed in, some want them submitted online electronically. So having the flexibility to do that is important. And right now it's hard to kind of picture how that would happen with just one system, one each EHR system.
Good point, Fern. Anybody else have any experience with that? Don't hear any. Okay.
I can give you just to kind of for Fern, if it's important or not, with Valent, because we use CCS, we see CCS patients in our clinic. In the Kenosha CCS, it's online. So the provider has to log into the portal and document online. So at our clinic, what we do is when a patient is first seen, the provider, as soon as anything is opened in that, it changes it to it's a non-recorded appointment. So we watch the non-recorded appointments, and then once the charting's done, it switches over to a recorded, and it goes to a pending transaction queue. So we kind of keep an eye on what we call PTQ and unrecorded, and monitor those to make sure that the providers are getting that documentation done. And then we don't send it out for billing until the CCS part is done. So we actually, our biller goes into CCS, approves it, and then we say it's done. So that using Valent, we are able to track it that way. It's just a process. It would be nice to have a simplified process, but there is a process. So to answer your question, that it might be something that you could figure out with the EHR, and it might not be as difficult as what it would sound like, because that whole process, it probably takes our biller 10 minutes a day. So as complicated as it sounds, it's not horrible. So just to expand on that a little bit.
Yeah. So that's one of the things that we were really talking with Jeanette about too before we started is all of this, all the different things that have to be done, all the different programs that some communities or counties have to work with. So trying to get all of that to work together is difficult, and behavioral health is a complicated sort of set of criteria to fit into an EHR system. So, and I think it's understandable, as Fern says, we would like it all to work and work together. But I was telling Jeanette, some of my reading has shown that behavioral health, because of its specialty area, is already somewhat complicated. And I think they're struggling to meet the needs of behavioral health clinics, and then to try to get all of these different pieces integrated and working together. So these are really important issues and good questions. It sounds like not a lot of people have solved them though, Jeanette. Is that right?
John, one question that I know we have as a poll for the group, and I don't know, but this is sort of an emerging technology, is that use of apps in behavioral health to kind of capture especially patient-generated type data. I don't know if that's something that we want to just poll the group to see if that's an option that they're looking at to kind of not necessarily help with the reporting, but to capture data that could potentially lead to quality improvement reporting and things like that.
Sure. You want to throw that up, and we'll just ask people to kind of give us a sense of, what they're doing in that area.
Here we go. I'm going to launch it real quick there.
All right. So just a quick question about using APIs to capture patient-generated health data. Yes, no, or plans, but not doing it yet.
Mm-hmm. And I guess one question I had for Jeanette is just as you're looking at this new EHR, are they talking about apps at all? Because it's something that, we do see a lot in the literature. I'm just kind of curious if they're offering anything to be used with patients.
Not that I have heard. I have not heard that come up. So it's interesting to hear it brought up now, because I haven't even considered that. So definitely something I'll make a note of.
Yeah, measurement-based care is an area that's also growing and becoming very important. Obviously, as clinicians, we want to know how patients are doing, and so measurement-based care becomes really important, and patient-generated data is part of capturing that information. So, well, look at that. No one currently using it or plans. Wow.
Well,
So
that,
I guess that, go ahead, Chris.
Yeah, I was gonna say, I mean, as a whole, that I'm not surprised by that. I mean, we see that
Yeah.
even, you know, primary care. I mean, it's slow uptake on those. I mean, I think a lot of maybe some of the larger systems have that ability in place, but it's been a slow uptake, and I think it's probably been one of their, you know, fires they've put in the back burner, especially during the COVID. So I
And I
don't.
think Pamela asked a really good question is, what is an API? Because this is a, you know, really an emerging technology. And basically what it is that ability to basically run an app. So similar to the way that you would, you know, go online and fill out information to purchase something, that is basically sort of the technical name for that, is that application programming interface that would interface with your EHR. So it is an emerging technology.
You can really think of it, you know, kind of in parallel, like with, you know, your Fitbit or Garmin exercise band or something like that. It captures data, and then you're able to upload that or transmit that to, you know, the EHR, which then, you know, digests that and presents it.
Yeah, I think some of the larger EHRs are already connected to Fitbits and things like that, right, Chris?
Yeah,
And
yeah.
are able to capture that.
Right. It, you know, it could be an application on your smartphone that, you know, I think what Gloria was saying, you could type in, fill out some forms or something, and then that application will interface with the EHR and, you know, take in that data. Then it's just that, it's that piece that does that translation, allows you to connect to the, you know, larger system.
Yeah.
In the behavioral health system, in the behavioral health space, I know we've started to see some for depression screening, addiction screening, those kinds of things. But it is emerging.
I know I sat on in a webinar for the total brain. So it's really the patient providing statistics and information that's driven from the patient to the clinic instead of vice versa. So, you know, as we all are using apps to do more things in our life, it's starting to make our way and its way into healthcare. But we recognize a lot of you are working to just get EHRs, and that might be like running versus getting up with data of EHR.
Yeah. You know, Lori, we want to do one other poll before we end today, right? We'd like to find out, oh, I'm sorry, we do need to do the resources. That's right. Thank you. Chris, do you want to walk us through some of the resources? It looks like we've got some of that Health IT Gov stuff that Ashley was talking about.
Yeah, exactly. Right. Thanks, John. Right. There's the healthit.gov site has just a plethora of information, and Ashley shared that RFP template, you know, as you probably all saw in chat there, but there's some other links we put in here. The current EHR users that provides some tips and tricks to people who are currently using EHRs, maybe help optimize or, you know, do some things they hadn't thought of. Then also the next resource listed there, the EHR optimization and workflow redesign for behavioral health providers webinar. That is a webinar that was put on by the New York eHealth Collaborative. I think it's pronounced NICE. Their NYEC is pronounced NICE. And that provides some information for, you know, tips and tricks for EHR optimization for behavioral health providers, maybe some workflow redesign to make it work better for you. So that's a really good resource. Continuing on down, future EHR users, the healthit.gov site, that gives you some things to think about, you know, during the selection, implementation phases, some things to ponder. Health IT Playbook, that's another healthit.gov. That's kind of an overall resource that touches on a lot of different areas. Then choosing the right EHR, that's right from the APA site, I believe, yes. And that provides some resources again about evaluating, selecting, and implementing EHRs. Just a lot of topics there to look at. And then same thing with the behavioral health apps. That's another resource put out by psychiatry.org, and they talk about some of those apps, behavioral health apps out there, and I think they rate some of them or provide some commentary on some of them, so that the APIs that we were talking about, some of those that they think might be helpful to practices or useful. So take a look at that, and these resources will also be in the transcript. I believe they'll get emailed that along with the transcript or the notes for this, right?
Yep.
So
Thanks.
yeah.
Great. Before we run out of time, we do want to do one more poll to find out about your interest in future topics. Lori, you want to throw that up for us just to kind of see what people would like to. So here's a list that we put together. It includes some things that we had before and a couple of new things. If you would just choose three topics from this list that are your most interesting to you, and then we'll try to follow up in future sessions addressing those that are most important to people.
Also, Jen, there is others. So if you don't see a topic that you're really interested in, please feel free to put that in the chat as well. We're always looking for other ideas as well.
Good point, Lori. We don't always think of everything, and sometimes people have very important stuff that, you know, we love to follow up on. Give y'all just a few seconds while you're finishing up that. I just really want to thank everybody today for the discussion, and I want to thank Jeanette for her presentation. And, you know, Jeanette, we'll see if we can't get you hooked up with some folks to, you know, to talk about maybe InSync or something like that, and see if we can't get some questions answered in that way as well. The next session for everybody is May 18th, and we will know more about what people are. Oh, look at that. So thank you, Lori. Looks like the winner today is measurement-based care and clinical quality measures, along with patient portals and workflows for telehealth visits. Okay. So I have a question just quick before we stop. If anyone is interested or willing to do a quick presentation on where your clinic is with one of these topics and ask the group for some input and, you know, and help with it, like Jeanette did today, we'd appreciate it. So please feel free to reach out to your Metastar representative, or you can raise your hand right now if you like. But anyway, we will be looking for someone to do a little brief talk about one of these topics, and May 18th will be our next session. Okay.
Okay. And I think Ferna typed another topic into the chat there too, so we'll want to capture that.
Great. All right. Thanks, everybody. Want to, you know, be cognizant of your time. I know you got other things to do. Thank you so much for all the work you're doing with our patients. We really appreciate it. Y'all hang in there. We'll get through this together. Have a good day.